Welcome to a journey into the world of rare eye diseases. Today we're focusing on birdshot chorioretinopathy, a condition as enigmatic as its name suggests. Join us as we explore its origins, effects, and management, shedding light on this complex disorder. The precise cause of birdshot chorioretinopathy remains elusive, a mystery that continues to puzzle researchers. While the exact trigger is unknown, it's strongly associated with the HLA-A29 genetic marker. However, simply possessing this gene doesn't guarantee the development of birdshot, indicating other factors, potentially environmental or infectious agents, likely play a crucial role in its emergence. Birdshot chorioretinopathy primarily targets the choroidal retina, the delicate layers at the back of the eye responsible for vision. The disease initiates an inflammatory cascade, leading to the characteristic birdshot, spots pale, creamy lesions scattered across the fundus. This inflammation disrupts the function of the retinal pigment epithelium, the layer that supports the photoreceptor cells. Over time, this damage can compromise the photoreceptors, resulting in visual impairment. Birdshot chorioretinopathy is considered a rare disease, with prevalence estimates varying widely. It typically affects individuals between the ages of 40 and 60, although cases have been reported outside this age range. There appears to be no significant gender predilection. Its rarity and often subtle initial presentation can lead to delayed diagnosis. The signs and symptoms of birdshot chorioretinopathy can be subtle initially, often masquerading as typical age-related vision changes. Common complaints include blurred vision, difficulty with night vision, nyctalopia, color vision disturbances, floaters, and photopsia, the perception of flashing lights. Some individuals may experience a gradual decline in visual acuity, while others may have periods of relative stability interspersed with flare-ups. Diagnosing birdshot chorioretinopathy relies on a combination of clinical findings and diagnostic testing. A thorough eye examination, including dilated funduscopy, is crucial to identify the characteristic birdshot lesions. Fluorescein angiography can reveal leakage from retinal blood vessels, indicating inflammation. Optical coherence tomography (OCT) helps assess retinal thickness and identify structural changes. Electroretinography at ER is particularly valuable, often showing a characteristic pattern of reduced retinal function, even in early stages. Genetic testing for the HLA-A29 marker can support the diagnosis, but its absence does not rule out the disease. Birdshot chorioretinopathy doesn't have distinct subtypes or classifications in the traditional sense. Its presentation can vary in severity and rate of progression, but it's generally considered a single entity defined by its unique clinical and diagnostic features. Currently, there is no cure for birdshot chorioretinopathy. Treatment focuses on managing inflammation and preventing further vision loss. Systemic corticosteroids are often the first-line treatment to suppress the inflammatory response. Immunosuppressive agents, such as cyclosporin, azathioprine, or mycophenolate mofetil, may be used for long-term control, particularly in individuals who don't respond adequately to corticosteroids or experience unacceptable side effects. In some cases, intravitreal injections of corticosteroids may be considered. Careful monitoring for side effects from these medications is essential. As the exact cause of birdshot chorioretinopathy remains unknown, there are no specific preventative measures that can be recommended. However, maintaining a healthy lifestyle, including a balanced diet and regular exercise, may support overall immune function. Regular eye exams are crucial for early detection and management of any eye condition, including birdshot chorioretinopathy. The prognosis for birdshot chorioretinopathy is variable. Some individuals experience a slow, progressive decline in vision, while others maintain relatively stable vision for many years with appropriate treatment. Untreated or poorly controlled inflammation can lead to significant vision loss. Research continues to explore potential new therapies, including targeted immunomodulatory agents, with the goal of achieving better long-term control and preserving vision in individuals affected by this challenging disease. Recent studies are also focusing on identifying biomarkers that can predict disease progression and response to treatment, paving the way for more personalized management strategies.